Hi, and welcome to my stakeholder presentation. Here are some questions. First, who am I? My name is Kayla Grubb, and I'm a third-year psychology major with a minor in biology at the University of North Florida. Why am I here? I'm here today to discuss an important issue on University of North Florida campus. And lastly, what are some ways that you, the faculty of North Florida, can help me with this issue? So let's get started. Well, judging from the title, you see my main concern is drug misuse, especially Adderall on university campuses. Well, what is Adderall? Is it a candy? Is it a hair product? A new dance move, maybe? Well, to answer your question, Adderall is a prescription medication used to help treat attention deficit hyperactive disorder, or ADHD, or what it used to be commonly known as attention deficit disorder, or ADD. This medication can be prescribed to both children and adults, which can help people with ADHD to help control their activities and increase their attention spans. Adderall belongs to a class of drugs called central nervous system stimulants, which works by increasing levels of the brain chemical dopamine, which helps stimulate neurons in the brain, so people can remain focused on what they're doing for long periods of time. So you're probably thinking, well, if it helps people control their activities and remain focused as well as increasing attention spans, then what's the issue? Well, students are abusing this drug for their academic success. Since Adderall increases the alertness and attentiveness, a growing number of students in college who do not have ADHD are using this drug to enhance the ability to think and focus to study for the exams. So why is this a serious matter? Why are students misusing this drug? Research shows that number of ADHD medication prescribed has significantly taken an incline. Some of these issues have gone noseblind from parents, but most importantly, faculty on campus. Recent studies show that the amount of pressure a student endures, whether it could be from external forces, such as parental pressures, pressures regarding graduation, to college admission acceptance, or even personal pressures the student puts on themselves. From a social cultural standpoint, students think that since these drugs are harmless to those who are being prescribed to them, they are safe to use without even thinking about the long-term consequences. Collegiate lifestyle nowadays have become more demanding of students. Students are to push the limits of how much they can handle academically, along with extracurricular activities, and even sometimes working full-time. Also, one last thing, Adderall is a very accessible drug. Students who know other students who have ADHD will easily ask or even pay for a couple of pills. Also, students give doctors false symptoms in order to obtain such prescriptions. So we already know that Adderall is regularly prescribed and is very easily accessible. Individuals who have ADHD are the ones who need and are prescribed such medications to help with their focus and increase their attention spans. But this is not a wonder drug for these students. Students who have no use for this drug have a sense of being supercharged, meaning they take this drug, they often seem to have normal ability to focus on tasks without being easily distracted. Students also take these pills in numbers of ways. The 4 common ways students take these pills are swallowing, which is the preferred way. Effects are noticeable within 30 to 90 minutes. Parachuting, which is crushing pills into a powder form and then eaten to speed up absorption. Snorting, which is crushing the pill into a powder and then inhaling it through the nose. And the least common method is plugging, which is crushing up a pill into a powder, and then they would add water to it and then insert it into the rectum. This method is similar to snorting and effects are immediate. So if students cannot find anyone who have these pills, they oftentimes go on what's called a black market website. And one of the famous black market website is called Silk Road. This website is where students can find any kind of pills at just a low cost of $10. Now, to me, this seems very dangerous and not monitored at all. Another thing is students use Adderall for midterms and finals. You can honestly step on any library campus and hear pill bottles rattling, whether they are using it for themselves or their friends. So, some of the symptoms individuals can experience, ranging from less serious symptoms to more serious symptoms. Now, the list to the left are the less serious symptoms, and we can probably pinpoint people who are experiencing these certain symptoms. Individuals may become nervous, they become more irritable, they may feel dizzy, they may even experience headaches or dry mouth, and you can tell by when students or individuals start drinking tons and tons of water. They may even experience heart palpitations, increased heart rate. On the more serious note, individuals may also experience shortness of breath. Their chest, their jaw, or left arm may start to feel painful. They may experience fainting or even sometimes seizures and stroke, and oftentimes confusion. Now, taking this medication can be highly addictive, and the withdrawal process is pretty serious if not used properly. So, what are some of the theories that can help explain why students abuse Adderall? Well, for one thing, persuasion. And we'll talk about persuasion having two different routes, the central and the peripheral route. The foot and door theory is also another way to explain why students abuse Adderall, and also learned helplessness. What is persuasion? Persuasion is the action or fact of persuading someone or being persuaded to do something or believing something. Persuasion has two routes, central route and peripheral route. The central route to persuasion involves the person to draw a conclusion upon prior experience and knowledge to evaluate the relevant arguments and presented in communication. This can be from mass media, it can be from a friend or even a parent. Personal relevant is basically a degree to which people expect an issue to have a significant consequence of their lives. In this case, they think Adderall is a positive influence in their lives. Peripheral route occurs when people are influenced by incidental cues such as a speaker attractiveness. And should students of University of North Florida accept the articulate and appealing message on how Adderall can improve and affect your GPA, the peripheral approaches can be very effective in producing changes in attitudes, and this can be for a short time period. Students also may use celebrities or role models to try to sell their pitch, kind of like what salesmen do. They can use all kinds of examples, like celebrities take Adderall not only to gain knowledge, but it also can make you lose weight. So you can become skinny and not have to waste your time going to the gym and focusing more on your studies. The foot and door theory is agreeing to a small request, which increases the likelihood of agreeing to a second larger request. Students are often unaware that they use this technique approach when they try to persuade others in taking Adderall. Oftentimes, students can just say, hey, pop one in, you'll be able to sit down, start focusing on your work, your grades will start improving, you'll be able to cram all the information you need for your midterm and finals. Students might even take small dosages, so that way they can see if they can handle the dosage. And then once they become acclimated, they might even start taking higher dosages, which could be even more dangerous if they're not correctly prescribed. Students might also cut pills in half so that way the other student does not feel afraid or worry, and that way they have someone else who is also taking the pill and see how they are affected as well. Learned helplessness is the last theory that we will touch base on. It is a condition in which a person or animal has come to believe he or she is helpless in a situation, even if this is untrue. Students who use learned helplessness oftentimes seek other things to help them cope, like using Adderall. Oftentimes, when students fail an exam, they think that they are not good enough. They also think, what's the use? Why am I even here? I'm never going to graduate. They oftentimes deal with internal struggles. And so the next time that an exam comes, like a midterm or a final, they turn to Adderall based on what they know and from their peers saying that it's going to improve their GPA or their test scores. So who needs to be addressed? Well, it's the faculty of University of North Florida, especially the counselors. I need your help in helping me monitor and try to decrease the misuse and behaviors of Adderall being on campus. So what can you do to help? Well, a Brain Booster workshop is a workshop that lasts up to 90 minutes and hands out planners to students to help with organization and time management skills that can occur with their busy schedule. After the Brain Booster workshop, students are to complete a goal completion worksheet, which will help demonstrate how they have incorporated what they've learned at the workshop and apply it to their everyday life. After the goal completion worksheet, students should attend a second workshop, and this second workshop would focus on students and their medication usage in a college setting so they can avoid misusage or distributing them. This workshop should also be required for students who are prescribed ADHD medications such as Adderall because they are the ones who tend to distribute them. After attending these workshops, counselors, doctors, and student health center should monitor students who have completed these workshops so they can see if they can weed out students who are just trying to get a quick fix. Another way that can help is drug seminars. These drug seminars are similar to the DARE program that kids were required to take in elementary schools. This seminar would teach students about how drugs can affect you if not taken properly. And lastly, clubs raising awareness. Certain clubs, like fraternity and sororities, could help tremendously as raising awareness around campus due to they have a positive influence on students. Now, I know what you're thinking. Those plans sound good and all, but what are some issues that could come from this? Well, students might not want to take these workshops, and I could understand why. Some might say, I don't need these workshops because I don't use Adderall. Well, I could agree with them, but implementing some of these seminars or workshops and student orientations so that it brings awareness, like having clubs make up skits during orientation or handing out flyers throughout campus, can be a major help. Teachers could also make incentives like applying an extra credit here and there to take one of these seminars. Students could also lie on their goal completion worksheet to make their answers seem like they need to take these drugs in order for them to succeed in their academic success. Some could say this could raise ethical issues for those with ADHD who are prescribed certain medications, is against a HIPAA violation, or even other ethical rights. But I can assure you that this is not what it's about. I do not want to eliminate medication if it is used properly. I just want to decrease the abuse of medication that is being distributed around campus. But some of the people who are distributing these drugs are the ones being prescribed. I can assure you, no one but the faculty, which includes your counselors and health services, could know your information if taking these. So just to recap, we have seen an increase over the years of students using Adderall. We also know that it is mainly full-time students who attend college and are ranging from 18 to 22 years old. We also know that students are under certain pressures and expectations from internal and external stimuli to achieve their academic goals and their successes. Some theories that we touched based on was persuasion, and it can also be sometimes a negative thing. Students can persuade others into using or even having them distribute other drugs. Students can also use two forms of persuasion, central and peripheral routes. They can also use the foot and door technique in making small requests and hoping of them agreeing to a second larger request. Students who use learned helplessness really struggle with internal conflicts and thinking that they aren't good at academia and tend to turn to using Adderall and other drugs in order to cope with their internal struggles. We've also discussed ways to promote awareness so we can minimize the use of students taking them of being distributing them around campus, which was the Brain Booster workshop to help with time management and organization, goal completion worksheet to implement what students learn and incorporate into their goals, a second worksheet to help weed out the true people who really need these medications from those who just need a quick fix, monitoring, such as counselors, doctors, a health center, making sure they aren't misusing prescriptions, drug seminars, similar to the DARE program to promote awareness, and lastly, clubs on campus using positive persuasion to help get the word out. That's it for my presentation, and thank you for taking the time to listen to this important issue.